The Centers for Disease Control and Prevention says the nation is facing its largest measles outbreak in 5 years. On Tuesday, New York City Mayor Bill de Blasio declared a public health emergency following an outbreak in Brooklyn. The city is mandating vaccinations for adults and children exposed to the virus, which had been declared eliminated from the U.S. in 2000. CBS News correspondent Tony Dokoupil has more.
Mayor Bill de Blasio's health emergency declaration was meant to stop the crisis from spreading.
We have a situation now where children are in danger. We have to take this seriously.
This Orthodox Jewish section of Williamsburg, Brooklyn, is ground zero, where some 250 measles cases have been confirmed within the last 9 months. The order requires residents older than 6 months who live or go to school in the affected area to get vaccinated or risk a $1,000 fine. And community religious schools known as yeshivas must bar unvaccinated children or face shutdown.
The city blames this school for letting unvaccinated children into the classroom, resulting in more than 40 cases of measles. Today's emergency declaration also means that disagreement over the outbreak in this tight-knit community is spreading too.
I believe God has created all human perfectly.
This woman has 5 children. None were vaccinated and all had measles in the last month.
I cannot agree to a systematic way of just altering the immune system and testifying to God's imperfection.
But this father believes all children should be vaccinated.
You got to trust the doctors. You got to trust the health department.
It's been reported that one man with measles traveled from Brooklyn to Michigan, which has since recorded 41 cases statewide. In fact, nationwide, there have been 78 new cases in the last week alone. Oxides Barbeau is New York City's health commissioner.
The importance here is to maximize the number of individuals that are being vaccinated against the measles and to allay any unnecessary, unfounded fears that people may have.
On that point, fears of the measles vaccine helped fuel the outbreak here in New York. Now, the CDC says that vaccines are safe and effective, but since 2001, the percentage of young children without any vaccination at all has quadrupled nationwide. And Elaine, despite that mandatory order here in New York, the city admits it can't physically force people to get a shot.
All right, Tony Dokoupil, thank you. Dr. Eric Choi-Peña is the Director of Global Health at Northwell Health Emergency Medicine in New York. He joins me now via Skype. Doctor, thanks so much for being with us. What are the symptoms of measles that people should be looking out for?
Well, it's great to be here. Thank you. The main symptoms of measles are going to be fever and then a rash that starts on your face and then moves kind of peripherally from the face and chest area out to your arms and legs. It can involve the palms and soles. It is exceedingly uncommon in people that have received the standard doses of vaccines and is very common in patients that have not been vaccinated, if those are the symptoms.
And why is this virus so dangerous?
So this virus is incredibly infectious. That's one of the reasons why it's so dangerous. It's very easy to catch. If you are not vaccinated and you are in an area where patients who have had the measles have been in the last 2 hours, it's airborne and you can catch it. And the chances of catching it are very high. And then it preys on the susceptible. So if you are an infant under 1, you are not able to be fully vaccinated or protected, and you are at higher risk of complications. It also can mutate and cause nervous system complications like brain damage and blindness in rare cases.
So the New York City Health Commissioner mentioned measles parties during a press conference earlier today. What are, quote unquote, measles parties?
So measles parties, I think, is referring to this kind of idea that if you can all get measles, kind of like the way people used to have chickenpox parties before they had the chickenpox vaccine, the varicella vaccine, that you will naturally convey immunity, and that will convey immunity. It's just also with all of the risks of measles virus, which the vaccine does not convey. I mean, people are worried about the safety of vaccines. The safety of the live virus infecting you is much more dangerous than a vaccine that conveys immunity.
So the outbreak in New York City is concentrated within ultra-Orthodox Jewish communities. So how does Mayor de Blasio's mandate factor in when you take into account religious or personal beliefs?
I mean, it's always a difficult decision, and I think engaging with religious leaders is very important. As you can see from your presentation, there is widespread differences of opinions among the Orthodox community, and there are those that are allied in helping vaccinate and convey that message. But there's also people that are not fully understanding of the safety or the efficacy, and we have to reach out to them. And then, as a society, we have to decide how much personal freedom we are willing to tolerate, because it's not just their children's lives that they are exposing this virus to. They are potentially exposing it to other people's children who are unable to get vaccinated, who have immune system disorders. That's a public safety concern.
Really important point. Dr. Eric Choi-Peña, thanks very much for your time, doctor.
Thank you for having me.